So guys, look at this question here. Mention Light's criteria for distinguishing exudative from transudative pleural effusion. So first thing you have to understand that the question is on pleural effusion. And they are asking you to distinguish between two types of pleural effusion. That is transudative pleural effusion and exudative pleural effusion. They are asking you to distinguish these two. How? By using Light's criteria. So let us get into it. First of all, what is pleural effusion? So fluid between pleural space. The word that you have to use is fluid. And what type of fluid? Serous fluid. The accumulation of serous fluid within the pleural space is termed as pleural effusion. If anything else accumulates in this space, it is called something else. Okay, we will not get into that because the question they have asked is on Light's criteria. So let's get into Light's criteria now. Okay. So basically you have transudative versus exudative. So transudative they're shown in one lung here and exudative they're shown in one lung here. So basically exudative means it has everything more. So I would say exudative is something which has everything more. So in the pleural fluid, if protein is more, okay, if protein is more or if LDH is more, then you are saying it is exudative. What is more? Protein is more, guys, focus here. If protein is more in the serous fluid or if LDH is more, then only you are saying it is what? It is exudative. Okay. So, how much more? So, that is what Light criteria will say. So, if the protein, when you compare the pleural fluids protein and the serum, our blood, in how much protein is there? If the protein is greater than 0.5, okay, in when you the ratio is greater than 0.5, then it is exudative. Did you understand, guys? Pleural fluids protein divided by serum protein, this ratio is greater than 0.5. Let's go with 0.5 only, otherwise I would have said half. 0.5, okay? So protein is more. Okay, so any one or more criteria, okay, then only it is exudative. So either protein is more or LDH is more. Now, so LDH in the where the LDH, the lactate dehydrogenase in the pleural fluid. In the pleural fluid, the LDH, if you divide this by serum LDH, okay, then the ratio is greater than 0.6. Okay, then again it is exudative. One more criteria is this. That's why it's 3-mark question, guys. 3 points are there. So first point, what did you see? Protein is more and the ratio is greater than 0.5. Protein, serum protein greater than 0.5. Okay, pleural effusion protein divided by serum protein greater than 0.5. Pleural effusion LDH divided by serum LDH greater than, what did you see here? 0.6. So this much we have covered. What is the third point? Third point is also talking about LDH only. But here they are not dividing by anything. They are saying if it is greater than 2/3 of the upper limit of the normal reference range of LDH in the serum. So that, so the upper limit, if we check according to biochemistry, okay, wait. First let's read the criteria. The third criteria, pleural fluid LDH is greater than 2/3 of the upper limit of normal serum LDH. So, when we check the reference range for serum LDH, it's coming 50 to 200 international unit per liter. So, I'm thinking 200 is the upper limit, right? Upper limit of normal serum LDH. So, my understanding is that the pleural fluid LDH is greater than 2/3 of 200, correct? This is how I am understanding it. Put one into sign here. This is how I am understanding it, okay? Pleural fluids LDH is greater than 2/3 of 200. That's what I am understanding, okay? So now Light's criteria is done, guys. You should be getting 3 marks, okay? But now let us say if there is exudative pleural effusion, why is it happening, okay? So let's try to differentiate that. So here there is transudative and here there's exudative. So now why is this exudative happening? What are the causes? Okay, so look at the causes here. It's written here. Infection, basically you should mention tuberculosis. Very important to say tuberculosis, guys. Then malignant disease, that is cancer. Pulmonary infarction, rheumatoid disease, SLE, that is autoimmune conditions, acute pancreatitis. So you have to mention these if they ask you why it will be exudative. Infections like tuberculosis, malignancy, right? Then autoimmune like rheumatoid arthritis, and SLE, etc. autoimmune conditions. Then you saw acute pancreatitis. Did we miss anything? Pulmonary infarction. Okay, pulmonary infarction. Rheumatoid arthritis, they didn't say. They said rheumatoid disease, guys. Okay. So why there is exudative, you have understood. Okay. Why will there be transudative? Transudative, you remember the main cause is heart failure. Heart failure is the main cause you can remember for transudative. Okay. So what is the cause for transudative that you should write? Cardiac failure. Very good. So will you be able to get marks for this question, guys? Mention Light's criteria for distinguishing exudative from transudative pleural effusion.